Welcome everyone to our kickoff January 27th, 2022. Welcome, welcome, welcome. Some of your folks I haven't seen since Mobilize. I am still here on the Chewevi land now of Southern Nevada, Las Vegas. They decided to keep me. I've been here about 90 days. Just want to change my name here. For those that don't know me, I know we have a lot of folks, new folks that are here. My name is Carol Cruz. My pronouns are she and Aya. She and Aya. I'm just trying to get them in there while I'm talking. And I am a person in long-term recovery since 1994. Recovery has given me so much, given me an opportunity to work with amazing folks like you and advocating all over the country and doing some amazing, amazing work. And, you know, being here in Las Vegas and working in my absolutely dream position. Got hired as Director of Education and Training with Foundation for Recovery. I get to work with Sean O'Donnell and Ryan and Garrett and Anna Maria and so many amazing folks here in Nevada, and working on the Peer Recovery Support Specialist certification and making sure our peers are out there in the workforce doing what they need to do, and they have the tools that they need and the training that they need so they can succeed in their position. And also the chair of the Inclusivity Caucus. And this evening, I am going to be sharing with you on harm reduction. And it's not going to be your traditional Narcan training. You might be getting that. Hopefully you're getting that training in your states. And I know that many of you are distributing Narcan and you're out there saving lives. And we really appreciate all the hard work that you all are doing. But I'm really looking at, you know, just providing some dialogue and some information around history, you know, defining harm reduction and how you define harm reduction in the work that you do, but also on the social justice movement, because harm reduction is a social justice movement. And just saw a post yesterday in regards to New Hampshire, and congratulations to New Hampshire. I see as New York, they're following New York and possibly opening a consumption site, you know, this is amazing, right? This just really shows the hard work that we're all doing, and keep doing it. Keep doing it. If you think that you're not making a you know, a dent in this hard work that we're all doing, you absolutely are. You're showing up, and that's all we ask you to do. So I'm going to share my screen, and let's see, I tested everything and hopefully it's all up here and running. So as a certified PRSS, I'm also you know, trained in harm reduction. And I've had, oops, there we go. Can you all see that? See the screen? Yeah, thumbs up. Wonderful. Thank you. So, and again, with the Inclusivity Caucus, I have learned so much around the social justice and inequities of how how folks are accessing harm reduction. So I'm just going to put this is what I hope that we can get through in this next hour. I'm going to try to keep it to an hour. You might go a little bit over. If you got to go, you got to go. This is being recorded, and you'll be able to access the slides in the Google Classroom. So again, life on life's terms, I know it happens. I totally understand. Feel free to go when you need to go. But these are areas in which I want to try to reach, discuss with you all today. Looking at, like I said, defining harm reduction, history, principles of harm reduction, stigma and discrimination, harm reduction as a movement, the war on drugs. We haven't gone, it hasn't gone anywhere. It's still here. how much it's failed. But we're looking at also the racism and harm reduction decade, and drug taking action around drug policies and reform. So here's some activity I'd like you to do. Would you mind please putting in the chat? I'm going to just try to look. How do you define harm reduction? Oops, there we go. I just clicked on it. Boop. How do you define harm reduction? Just put that in the chat. I see anything positive from Michelle, a positive change. Michelle, it's amazing. Okay, unconditional love, compassion, keeping people safe, saving lives. Thank you, Tammy. Valuing human life, radical acceptance. Wow, they're going really quick, so I'm trying to catch up. Harm reduction is taking action to help, preventing diseases, meeting people where they are. Yeah, that's a lot what we share in our peer training. Meeting people where they are. Okay, awesome. Thank you so much. All right, let's see. Got a few windows here to move around. Let's see, I'm going to take you and I'll bring you right over here. Okay, wonderful. All right, so let's look at it, some additional, and all of your definitions are right on point, right on point. That's the mouse. There we go. So harm reduction is a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. Harm reduction is also a movement for social justice built on a belief and a respect for the rights of people who use drugs. How do folks feel about those two descriptions of definitions? You can raise your thumb, you can raise your virtual thumb or finger or hand or heart or whatever, how you want to express yourselves. How you all feel about that? And this, again, these definitions come from a training that was built with Jim Wolfen and Dean Lemaire, and I'll have those resources for you at the end. Another area in which to define, and I'm actually going to take someone off of chat because I always love group participation. And I am going to pick, I'm going to ask Angel. Angel, would you mind coming off of mute and
Yes,
reading
here I am.
this? Thank you. Would you mind reading this definition for me, please?
Yep. Harm reduction can be viewed as an end in itself with a focus on mitigating harm to individuals, families, and the community as a whole. And harm reduction strategies can be viewed collectively as a platform or point of access for promoting long-term health, and for those with severe alcohol and other drug problems, long-term personal and family recovery.
Thank you so much, Angel. I'm going to give you an opportunity. Would you like to share anything around that? Or is this harm reduction new to you? Is this your first time really being introduced to the concept of harm reduction?
Absolutely not. I believe in harm reduction. I can tell you I'm a person in long-term recovery. And there was a time in my own personal and professional life, I was like, no, we're not doing that. And I had to realize that it was my own story with MAT that gave me those thoughts. So in working around that through my own process, like I believe in harm reduction, and I currently have family members who use different types of harm reduction, and it is saving their lives. So I absolutely believe in it. And I believe that it's not just for the individual who is impacted with the disease, but definitely with the family. I'm big with families, Carol.
Mm-hmm. Yes.
They
Well, thank you
suffer
so
terribly.
much for sharing your personal views and your personal story with us. And this is how the rest of the night is going to go. We're going to interact with each other. I'm not one that likes to read slides. I'll provide them for you, but if anyone knows me, and I'm very animated in my and how I address trainings in any way. And I really love, I look at you all as experts, and I learned so much from all of you. So please feel free to raise your hand if you want to volunteer to read. Otherwise, I'm going to pick on you. Okay, we got Randy. I'm going to have Randy read the next slide for us. Go ahead, Randy. Oops, nope. Wait a minute. Sorry. Oh, it's going the wrong way. Ooh, okay, wait a minute. We'll get it. Always a technical difficulty. 3 years with Zoom. Haven't learned a thing. There we go. Go ahead, Randy. I'm going to take you off of mute.
I just did.
Okay, wonderful. Thank you.
Thank you all for having me. Hi, Carol. My name's Randy. I'm from Maine, and my pronouns are he, his, him. Harm reduction defined. Harm reduction is a way of life. It's a way of reducing harm or risk in any practice in which you're involved.
Thank you so much, Randy. Anything you want to just plug in there real quickly around harm reduction? Is it new to you as well? Or is this something that you're also practicing or you're sharing with folks there in Maine?
We share it extensively up here in Maine. I personally can't use harm reduction. I'm all in or nothing, but Jesse Harvey helped save me, and this was his poster child, and I will back him 100%.
Thank you for sharing that personal story, Randy. I really appreciate you and all the great work that MeWrap is doing.
Thank you very much.
All right, let's see, whoops, mouse. There we go. All right, let's dive into some history. If someone wants to tackle this whole slide, that's quite all right. I just want to really pull out some key points around the history and the syringe access programs. But I see I have James. James Youngblood. There you go.
Okay, can you hear me?
Yes, you can.
Yeah, hi, I'm from Michigan. Okay, I'll just read it. Syringe
Thank you.
access programs. Emerging bloodborne virus crises worldwide led to a controversial prevention tactic, syringe access programs. In 1984, people who injected drugs in the Netherlands started the first syringe access programs in Amsterdam to address the spread of hepatitis B. 2 years later, small underground networks of drug users, researchers, and AIDS activists began distributing sterile injection equipment in the United States. In 1988, the first legally sanctioned syringe access programs in the US was established in Tacoma, Washington, after Dave Purchase, a drug counselor, challenged the state and city laws and operated SAP in plain view. There are 335 syringe access programs active in the US as of 2018.
So we know that this data is not as updated as we'd like. I probably can go on Google and find some more updated information, and I do apologize for that. But thank you so much, James, for reading. Is there anything would you like to comment around harm reduction?
Oh yeah, we have a great organization here in Michigan, Harm Reduction Michigan, and I've recently been in contact with them. They do a lot of good around here. I did a lecture in Gaylord for harm reduction, and hopefully lit a fire under a couple people that had no clue about it. So you know, it's just getting the word out. You know, I mean, it's unfortunately, you know, like a lot of people don't even understand the concept, but as people learn about it, they seem to be pretty open to it. I like it. Awesome.
Thank you so much, James. And thanks for all the work that you're all doing there. You know, James just reminded me, if your state has policies or doing any specific programs, and you just want to showcase it and let other people know that are here on this training, please feel free to add it into the chat. All right, really appreciate you all doing this work. Let's see. All right, let's go on to the next slide. It's moving right along. Housing first. Where do I got? I got Bill. Is that Dr. Bill or Mr. Bill? Hold on. I just asked. Yeah, you can take yourself off of mute, I think. There you go.
That's Brother Bill, not Doctor.
Brother Bill.
Brother. Okay. Yeah, I'm a Franciscan friar. Okay. I'm in long-term recovery. I'm a big exponent of fentanyl test strips. We hand these out a lot here in West Virginia, fentanyl test strips. We have problems with needle exchange. Our governor tried to pass a funky law to keep us from doing needle exchange. We had a real open needle exchange in the state, and now we have messed up, but we're trying to get it fixed. Anyway, harm reduction history, housing first. Amen. Amen. Housing first is premised on the notion of housing as a basic human right that cannot be denied, even for those who continue to use alcohol and other substances and or refuse to participate in prescribed services. Housing First programs usually incorporate wraparound services addressing residents' global health and offer permanent independent housing for free or up to 30% of a resident's income. The Housing First model was popularized by Sam Sinerbis in New York NYC-based Pathways to Housing program, launched in 1992. Similar programs have since been implemented in most U.S. cities and European countries, Australia, and Canada.
Wonderful. Thank you so much, Brother Bill. And I really, again, I love the fact that you had right next to you those testing strips at where I work. We just recently, all our staff went through a training with the test strips, and we also have Anna Maria that oversees our recovery friendly workspace, along with another staff. You know, they've been putting together kits and all our Narcan kits and everything, you know. So when we have people come into our RCOs, we are making sure that they're not leaving without, you know, learning how to use the test strips and also walking out there with Narcan. So thank you all for all the work that you're also doing. Again, you know, I'm getting a lot of energy, and if you, hopefully you're also getting energy from me. I know it's a little later your time. But what I'm hearing here is, you know, it's about saving lives, right? That's what I entitled this whole training about. We can again, we're going to dive into some talking about social justice and racism around harm reduction, how there's discrimination still out there, how we're, you know, still the numbers are, you know, reaching just immense numbers that they shouldn't be, right? But I'm so happy that you all are able to celebrate the work that you're all doing. So just remember self-care and make sure you continue to celebrate the work that you're doing. All right. Let's see. Supervised consumption spaces. Do I see a hand? Do I see a hand? Anybody? Daniel, I'm going to take you off and mute. Oh, Danielle, I'm sorry. Hi, Danielle.
Hi, sorry, I had to.
No, it's okay.
I'm Danielle. I'm in Indiana. I'm a firm believer in harm reduction. I feel like harm reduction and needle exchanges that I have access to in Indiana is one of the reasons why I'm as healthy as I am today. I'm also in long-term recovery. Okay, harm reduction history. Supervised consumption spaces are medically supervised facilities designed to provide hygienic and comfortable environments in which individuals are able to consume illicit drugs and access treatment and other health services and education. The SCS concept is an outgrowth of low barrier drop-in centers of offering sanctuary, peer support, a range of health and social services, and sterile drug equipment for homeless and drug-using populations. The first SCS opened in Bern, Switzerland in 1986. Insight, the first SCS in North America, opened in Vancouver, British Columbia, Canada in 2003. There are currently over 100 SCSs operating worldwide. Only underground SCS is in the US as of April 2019.
All right. So thank you again for sharing your personal story. And I love that folks, whether you're family members, allies, people with lived experience. Thank you for sharing your personal stories, because that's how we are. That's how I see RAP really coming together. You know, it started with Ryan and Garrett and Aaron, you know, bringing us all together, you know, but we're the ones that are accountable at doing the work, right? And sharing our stories and leading with our lived experience, you know, whether it's a friend that we may have lost because they couldn't access harm reduction. So thank you so much, Danielle.
Yes, absolutely. My personal experience, I feel like, really opened people's eyes and gave them perspective on what harm reduction actually means. Some people that were once against things like needle exchanges maybe second guessed it whenever I would give them that perspective of, well, you know, I'm very blessed to have the good health that I do coming out because I had access to these clean needles. So thank you.
Thank you, Danielle. You know, and if you're on the call here and in harm reduction is new to you, I say, like, again, stretch yourself, you know, ask questions, put them in the chat. I'm going to try to follow through with the chat as well. And if I didn't see you, please raise your hand. I'll make sure that we address your questions, because I do want to make this more interactive than just showing you a bunch of slides. All right. And I got my friend here, Mr. Johnny Fab. All right. Take you off of mute. Love your border there. There we go.
Thank you, Carol. Harm reduction history. Yes, naloxone has been used to reverse opioid overdoses by emergency medical personnel since the 1960s. That's incredible, right? Since the 1960s. Following years of illegal dispensing and use of the opioid overdose reversal medication among people who use drugs, states began allowing use and administration of non-medical personnel in the late 2000s. And as of 2019, naloxone is legally available without a prescription in just 42 states. In an effort to save lives, states have implemented laws to make it easier for first responders and the general public to obtain naloxone. As of August 2020, all 50 states in the District of Columbia have some form of a naloxone access law. The laws are varying significantly by state.
So John, what are you doing in your state? What's going on? Give us a heads up. Give us an update.
So with harm reduction in our state, there are currently 2 bills that are in legislation for fentanyl test strip access, syringe service program access, but we have a law already in Pennsylvania in place where anyone can access naloxone without a prescription. So all they need to do is, there's a standing order, is go to their pharmacy and fill out a form, and they can get naloxone. But Carol, I would just caution that you know, not every time that we say something is good is it a good thing. There are some discriminatory issues that are happening with healthcare administrations and for giving you access to healthcare if you have a prescription for naloxone. So it's like really crazy. Like they want to use that against you, but you know, we have such a wide variety of being able to supply naloxone to individuals in our state that, you know, naloxone has now, it's like we're so far behind. We should have this. Like 1960s, it was available. Why are we in 2022 and we're still trying to get access to naloxone? You know, we should be talking about New York City, you talked about earlier, has 2 now supervised consumption sites up and running. And by the time I left here to leave the country in late 2021, they had already saved hundreds of lives. By now in 2022, even months later, I just imagine where we're at. Harm reduction is just something that we need all to embrace one way or the other.
Awesome. Thank you so much, John. Good to see you. Thank you for giving an update. And again, folks, keep putting your what your state is doing in the chat if we don't get to you this evening. Really, I think, again, when we see and hear hear our stories and we put out this information and we share about legislation, like I'm not a person that does well with policy and legislation. I know that we have a lot of experts out here in this audience tonight that do. and getting these laws passed, right? So if you're in your rap group, if you're new in your rap group and you're like, what can I do? What can I bring to the table? How can I advocate for change? You know, we're about intersecting and collectively, we're a collective here, but we're about collaboration, right? It's not just what one state does and the other state doesn't do. Like, let's work together, right? Nationally, we're powerful in numbers. We're powerful in numbers. So just remember that you're not alone. All right, let's move on. Okay, so we're going to look at some principles of harm reduction, health and dignity, participant and center services, participant involvement, participant autonomy, social, cultural factors, and pragmatism and realism. Sorry about that. A little tongue-tied. All right, can I get a volunteer? Don't see any hand raised, but it's always open. Okay, got one. Here we go. Jordan, where are you? There you are.
Hey, Carol.
Hey.
Jordan here, Pennsylvania. Principles of Harm Reduction, Health and Dignity establishes quality of individual and community life and well-being, not necessarily cessation of all drug use, as the criteria for successful interventions and policies.
Thank you so much, Jordan. Would you like to share anything personally or anything related to this slide or any of the slides that we said we put out there previously?
Yeah, you know, with couple weeks will be 9 years since I lost my brother to an overdose. And through a lot of therapy this year, I had to give myself some grace because I couldn't do what I didn't know. And 9 years ago when he was using, I didn't know about harm reduction. And I came from the era of tough love and rock bottom. And if I had known what I know now, my brother might still be alive. And he's the reason that I so fiercely advocate, because just people, all people deserve to have somebody that is willing to fight for them. You know, and it's why harm reduction has become something that is so important to me, and I will advocate until I take my last breath.
Ken, thank you. I'm sorry for your loss. Jordan, I've spent a little time with you at Mobilize, and you're an amazing person from the inside out, and the work that you do despite the tragedy that's happened in your life. And I know we have others on the call, family members and siblings and loved ones. I so appreciate you stepping into this role of advocacy and the work and hard work that you're doing and bringing alongside people. Like, we're not calling people out, we're calling people forward, and that's when I look at inclusivity. I want to look at, there is a time when we do need to call out people, and those are the politicians, right? But I love calling us forward into this work, and we have an opportunity to, again, save and change lives. So thank you so much, Jordan. All right, do I get another volunteer? See, hand raised. I'm gonna put that person in the room. Tom, there we go. Oh, I lost you. Where'd you go, Tom? Did we lose connection with Tom? Tom. All right, we'll get back to Tom. Can I get another volunteer? We got David. Hey, David, where are you from?
Hi, I'm Dave. I'm based in northern New Jersey.
Hey, Jersey. I'm a Jersey girl.
I'm a person in sustained recovery and a supporter of all paths of recovery, including harm reduction. Principles of harm reduction, participant-centered services, calls for the non-judgmental, non-coercive provision of services and resources to people who use drugs in the communities in which they live in order to assist them in reducing attendant harm. Services need to be accessible and low threshold for people who use drugs. Abstinence is not a requirement for services.
Yes, yes. Thank you so much, David. And anything else you'd like to share? What are you doing there in northern New Jersey?
I'm
What part exactly? What town?
Morristown.
Yeah, did a little time there in Morristown.
Yeah, I'm active in the recovery community here as a volunteer and board member on nonprofits. Also, I facilitate my connection with harm reduction. I practiced it myself for years before choosing abstinence with respect to alcohol, and I still facilitate moderation management meetings and programs here in the New Jersey area, and I consider it also a harm reduction path of recovery as well.
Thank you so much, David, for sharing your personal story and sharing that information. You know, as a trainer with peer recovery support specialists, and most of us are folks that lead with our lived experience, and we've even, it's a new age in how we're presenting our training materials around moderation based recovery, around harm reduction, MAR, medication assistance recovery. So I am so happy to hear that people are in this practice. And again, we are living proof that it works. We're living proof that it works. So thank you so much, David. All right, let me let this person in the room. Did Tom get it back in? Did we find Tom? No. Okay. Can I get another hand raise? I'm going to pick somebody. Here we go. Courtney. Where are you from, Courtney? Oh. Are you off mute?
No, I'm sorry. Hi.
Hey.
I have two speakers happening. So I am a Jersey girl as well, a Northern Jersey girl. However, I'm in Indiana, so I'm here representing the state of Indiana. Indiana's rough a little bit, I think. We've adopted needle exchange programs and harm reduction methods, but we face a lot of local resistance. So there's a lot of police departments. There's a lot of community partners that have no interest. We had Scott County, Indiana had the largest HIV Hep C outbreak in the country a few years ago. And we had our first needle exchange program. Local officials just ended that program, even after significant data of why it should maintain. So it's an uphill battle here, but we've got a bunch of people fighting the fight. So yeah, nice to see everybody.
Nice to see you. Would you mind reading the slide for us? Thank you for sharing.
Principles of harm reduction. Participant involvement ensures that drug users and those with a history of drug use routinely have a real voice in the creation of programs and policies designed to serve them. Nothing about us without us is ever for us.
Yes. Thank you so much. Thank you so much for being here as well, Courtney.
Thanks.
I'm sorry, did you have something else to add?
No, I'm really excited that everyone's here. It's really nice to see representation from all over the country. I love it.
Wonderful. Is this your first year at RAP? Welcome. All right, I see Tom is back in the room. Tom. Let's see, I'm gonna just take you off, find you and take you off of mute. At least I'll let you back in. Now I can't find you, Tom. Oh, there you are.
I'm here, I promise. Hiding in plain sight. Principles of harm reduction, participant autonomy. Focus on solutions that maintain autonomy for service recipients and not paternalistic solutions that dissolve personal choice. Affirm drug users themselves as the primary agents of reducing the harms of their drug use and seeks to empower users to share information and support each other in strategies which meet their actual conditions of use.
Thank you so much for reading, Tom. So what's going on there in Virginia? Give us a heads up.
Well, as far as SSPs go, it's done on a county by county, city by city basis. And so we've talked in the city and county I live in, you have to get the sheriff to approve it. And we just have a brand new sheriff in town who seems pretty progressive. And so we're going to start working on that here. Our state SSA has a harm reduction person, met her briefly, and then haven't seen much sort of visibility in terms of some of the work she's doing, but I want to get in touch there too and find out more what they're up to.
Awesome. Well, thank you so much for representing Virginia and being here, Tom. We were on a live Facebook Live with the Inclusivity Caucus last week with Tootle and Lynette. And we're going to have more of those listening sessions on live social media and talking about some really looking at equitable access to recovery spaces, healthcare, you name it. We're going to be talking about it. So we had our kickoff meeting with the Inclusivity Caucus, and Tom led that discussion last week. So thank you again so much.
Thanks, Carol.
I just want to address, thank you. Just want to address one thing. I want to just go back to it real quick because I was looking at David. Hey, David. David had me share on a panel last year, and I think you. And I prefer people just to say they're in recovery, and that is what we encourage when training our peers in Missouri. That's all. That's great. You know, again, I got a lot of my training out of Connecticut. And Mark Jenkins, who is amazing harm reductionist with the Hartford Coalition for Harm Reduction there. And I introduced him to the peer training around harm reduction. And he said, you know, I love this training, Carol, but you know, a lot of times I don't even mention the word recovery to my folks. I just make that human connection. He said, harm reduction for me is making a human connection. You know, and checking in with that person and hoping that they come back the next day. And I really took that on, you know, so again, when I do the training, we lead with the word recovery, but whatever meeting that person where they're at, and if recovery is not the word in term that how they identify, it's making that human connection and treating them with dignity, respect that I really enjoy doing in the work that I get an opportunity to do. And I amazingly see that you all do that as well. So thank you. Let's move on. Move on. All right. Principles of harm reduction and social cultural factors. Can I get a hand raise? Here we got Michelle. Hey, Michelle. There she is.
Can you hear me?
Yeah, hon.
Hi, good to see everybody. I love that I'm here right now. Can I just say that? I am a person in recovery, and I'm also harm reductionist in Illinois, Northern Illinois, and just recently a peer doula. So I work with parents who use drugs and try to navigate what goals they have and give them autonomy over themselves, but also to be able to know what their rights are as a parent, regardless of their decision. So yeah, blessed to be here. Principles of harm reduction, social cultural factors. Recognizes that the realities of poverty, class, racism, social isolation, past trauma, sex-based discrimination, and other social inequalities affect both people's vulnerability to and capacity for effectively dealing with drug-related harm. Amen.
Thank you so much. Thank you so much. And thank you again for all the work that you're doing there, Michelle. And congratulations on your newly position. Doulas, you know, I think it's amazing, again, how we're bringing in other means of bringing resources to folks and reducing harm. I love that. Thank you so much. All right. Let's see. Oh, Michelle. Oh, yeah. Your hand's still raised. Did you have something to add? I'm sorry. Hold on. There you go.
Okay, all these buttons, sorry. Yeah, I just wanted to add too, like, one of the great things that I get to do as a harm reductionist and taking on this new role is work with doctors and nurses and emergency room people that all discriminated against me for being a person who used drugs when I went in for help that I deserved as a human. And just seeing doctors acting differently, nurses, people in healthcare acting, you know, actually caring about the people that they serve instead of judging them is just an amazing part of being a part of the change. So yeah, I'm just blessed, beyond blessed.
Thank you so much. And thank you for adding that. Okay. I'm going to go through a couple more slides. I got a couple of videos, and then I want to open up for like the last 10 minutes for folks that I might not have seen your questions. Again, you'll be able to access the remaining of the slides. Again, I want to keep this to in 1 hour, and you'll get access to this recording, to this training. Can I get someone to read this slide? Do I have a hand raised? There we go. Heather. Hey. Love this person. Love this person.
Hi, Carol. Hi, gang. How is everyone?
Awesome.
So I am from New Jersey. Not the fun New York part that David is in. I'm in the Philly part. We fight about things besides pork roll and Taylor ham. And by the way, it's pork roll. Anyway, I'll read the slide first, and then I'll tell you a few things we're doing here in Jersey land. So principles of harm reduction, pragmatism and realism. Accepts for better and or worse that licit and illicit drug use is part of our world and chooses to work to minimize its harmful effects rather than simply ignore or condemn them.
Yes.
So I'm very proud of our little humble state here. We just passed several pieces of legislation. So we decriminalized having syringes. So now we can pass out syringes, which is awesome. That bill also took care of anybody that had a syringe charge, it expunges it. We also struck down the municipality regulation, which was different individual towns could decide not to have a needle exchange, and we took that away. So now the Department of Health is overseeing it. So we're like really excited about that. And they also tagged on with the syringe one. They finally decriminalized fentanyl test strips. So we can actually give them out now as well. So if anybody wants model legislation for their states, you know, get in touch with the gang and we'll send it over to you.
Amazing. Thank you so much, Heather. You know, I saw you a post that you put in social media last week around, I don't know if it was a harm reduction training that you had just come from, or you were doing one, and you mentioned around MAT. Do you know what I'm speaking of?
Oh yeah, so I usually am doing the harm reduction training, so it was really cool to go to somebody else's. Another reason that I'm here tonight. You know, always good to learn more and get a different perspective. But the trainer was specifically talking to clinicians. So like, it's kind of like one battle at a time. So he used some language that we wouldn't necessarily use, but he was awesome and he was funny. And he was like, hey, you know why? Oh, this was it, Carol. It was, I said, medical marijuana. So you can correct me on that in a second.
Cannabis.
But he said, you know why medical marijuana isn't recognized by the American Medical Association or any of the other things? Because Nixon was a racist. And all of these counselors were like, huh? Because they were just being introduced to harm reduction. So it was awesome, but it's great because Carol chimed in and she's like, we don't call it marijuana, Heather, we call it cannabis. So
yeah,
so
marijuana is racist, right?
Yeah, so
you know, marijuana, it was you know, mostly the folks that were targeted were Black and brown folks, mainly folks from Mexico. So again, when you're in that place, I know a lot of states are opening up with recreational. I'm here in Las Vegas, recreational and medicinal. We have it here, and it is cannabis. We have to, again, change our language. When we change our attitude, we change our language, we open and stretch ourselves. Again, we can make changes. We can save lives. We can remove the stigma and the labels behind a lot of what we've been experiencing due to the opioid crisis. And we're going to look at some information and watch a little slide on war on drugs. Okay, so thank you again, Heather, for all the great work that you're doing. All right, here's one of those videos that I would like to show you. Hopefully you can hear it. All right, here we go. All right. It's not doing anything. Hold on 1 second, folks. There we go.
I see the dark-skinned bodies falling in the street as their ancestors fell before the whipping steel, the last blood pooling, the last breath spitting. I see the immigrant street vendor flashing his wallet to the cops, shot so many times there are bullet holes in the sole of his feet. I see the deaf wood carver and his pocket knife crossing the street in front of a cop who yells, then fires. I see the drug raid, the wrong door kicked in, the minister's heart seizing up. I see the man hawking a fistful of cigarettes, the cop's chokehold that makes his wheezing lungs stop wheezing forever. I see the poets who will write the songs of insurrection generations unborn will read or hear a century from now, words that make them wonder how we could have lived or died this way, how the descendants of slaves still fled and the descendants of slave catchers still shot them. How we awoke every morning without the blood of the dead sweating from every pore.
In so many ways, this is the best and worst of times for drug policy reform. There have just been, a tidal wave of extraordinary successes, mind-blowing victories for marijuana decriminalization and legalization. Seems as though we have reached a tipping point. And yet, at the same time, in this same very moment, we face an unprecedented drug crisis in this country. Drug overdoses are at a record high, making the crack epidemic seem somewhat mild. Now, the crack epidemic killed just a tiny fraction of those who are dying of opioid overdoses today. And yet a literal war was declared on poor people of color. A purely punitive, militaristic response prevailed. There are few politicians blasting the mostly white opioid addicts, portraying them as people worthy of care and compassion, not despicable scum of the earth that has to be gotten rid of by any means necessary. Things are very, very different this time around, and we all know why. Whiteness makes a difference. If the overwhelming majority of the users and dealers of opioids today were black rather than white, we wouldn't have police chiefs competing with each other over whose department is showing more compassion to people struggling with drug addiction or drug abuse.
I should have been able to go to treatment instead of prison. When a policeman killed my 5-year-old son, and I used drugs to medicate my grief and pain, and I was criminalized. I was sent to prison over and over again. No one ever thought about treatment for me. While I believe that treatment is the better approach, but because I'm a black woman, I was put in prison.
Why is racial justice so central in terms of drug policy reform in America? Well, racial justice is absolutely intertwined with the war on drugs in the United States. From its very beginning, over a century ago, the war on drugs was focused on people who were different from the white majority then. So, first it was used to stigmatize Chinese people in the US, saying, oh, they were the ones responsible for opioids. Then it was Black people, then it was Latinos, and it's always been tied up with this effort to oppress and paint communities of color, paint disfavored communities as criminals, as bad people who should be locked up. Black and white people and brown people all use drugs at the same rates in the United States. But Black people and brown people are far more likely than white people to be arrested. And that's because the war on drugs has been used as an excuse to heavily police communities of color.
The drug war in particular have reproduced the social order of slavery in the same way that the Jim Crow laws did beginning in the 19th century.
Louisiana is a very special case. We're the most locked up political entity in the world. And I'm a little late, I apologize. I was actually working on a brief to the Louisiana Supreme Court on a second appeal over a young black man who's given 20 years in prison day for 3.5 grams of marijuana. Today in the paper, we had a big package of sentencing reforms go through in Louisiana. And they kick in November 1st. Today we have one of our sheriffs actually called a press conference to complain because they're forcing us to release all the good ones. Yes. These are the people that we can send out, we can rent them out, and we can make money off of them. And the legislature's passed this law that's going into effect at the end of this month, and I'm going to lose all my good prisoners. This is the racism that's at the core of what's gone on and driven this drug war from the beginning.
This newfound tolerance and compassion for white users and abusers of illegal drugs will translate into a permanent ceasefire in the drug war, and that the shifts in law and policy will inevitably benefit people of all races and classes in the long run. I have my doubts about this. Imagine pot being legalized near the peak of the crack epidemic. And then try to imagine that all of the new legal drug empires that are being launched are being led by young black men with wild afros and tattoos rather than hipster white men with cute ponytails and beards. No. It wouldn't happen. It wouldn't happen. Just no.
To the drug war and drugs. If I knew how to change the public attitudes around racism, I would have been done it. I don't know how to change people's core beliefs about black people and brown people. I don't know how to do that. If I did, I'd have been done it. But what I do know how to do is to help those communities that have been, especially women, that have been impacted harshly by antiquated and ineffective drug policies. And that's what I do.
Again, we got about 4 minutes, may go a little bit over time. Again, I don't want to hold you all hostage. I'm actually going to hold off. I saw in the chat, asked it in the chat. Yes, you will get access to these videos. There is a link that is on the slide, but we will also add that link on a separate note in the Google Classroom, and you'll get access to that sometime early next week. Okay. So I really want to open up because the rest of the information I do have, listed out here in regards to the movement. And we are a part of that movement. So let me take us all off a share. And I really just want to direct the last question that I had on the slide is, you already shared tonight some amazing work that you're all doing and you're taking action. And there's no doubt that we need to change policy. And like I said, I'm not the scriber, the best in scribing. But I know in numbers and what other states are doing, and we can copy and paste and add our information and we can make those changes. But I'd love to hear from anyone that would like to share who didn't get an opportunity to share on, because we could keep emphasizing on the problem and the solution gets put on the back burner. But this video maybe was a couple years ago. We know that systemic racism is alive and kicking, right? And it is in the recovery spaces. And that's why we started the Inclusivity Caucus, because we needed to create safer spaces where all inclusive, right? So that we can have these uncomfortable discussions and we can start making change. And we can end what was supposed to be ended a long time ago, the whole failure on the war on drugs. We got a lot of work to do. I hope it happens in my lifetime, but I'm going to open the floor for the next at least 10 minutes. If anyone would like to share, again, I ask you, keep it to 2 to 3 minutes so that we can get in as many shares as possible. And you will, again, get access to this material. See, we have a couple hand raised. I got Karen. Karen, I'm going to unmute you. There you go. Where are you from, Karen? Karen Barnett. I just sent you.
Okay, I'm unmuted now. I said,
Yes.
Good evening. I am from Cumberland County, and I am from the rural yet urban designated municipality of the city of Bridgeton. I work in the city of Bridgeton. One of the things that I have seen over the years of doing advocacy work is that Black and Browns normally are not at the table. So if you're not sitting at the table, you're part of the meal. And when you're part of the meal, it means that you are part of the poverty smorgasbord. And everyone else is telling you what you need, but they're telling you what you need from their lens. And one of the things that I specifically have seen since I've been doing advocacy with NCADD and now New Jersey RAP and other organizations is that Black and Browns are beyond underrepresented. They are not an intricate part of the movement. And oftentimes I believe that they are intentionally excluded. It's not until we look at the social justice piece and the disenfranchisement and abuse of the Black and Browns as it pertains to policies, the Department of Services, and their inclusion in becoming an intricate part of policy development, that we're going to change the lens that they are seen through. But more importantly, we're not going to be able to adjust to propinquity that increases the rapport and pulls individuals in so that we have a level playing field, but we have a playing field that's centered in justice. Because unfortunately, we live in a visual world. So the first thing that individuals will see are the differences, superficial. But on paper, we would all present the same. So one of the things I said before, this is a very, very uncomfortable conversation, but more importantly, for those of us who are Black and brown, it is painful. It is painful to sit and watch those movies, those videos, because it's part of all of our truths. And so when we look at the Department of Medical Services, when we look at access to recovery, when we look at parity, when we look at all of those things that we say that we believe in, we have to make sure that they are just for everyone. Everyone, not based on our lens, but on equity. On equity. So I thank you for showing those things and making people uncomfortable. But people need to understand, as uncomfortable as they are seeing that, that is too many individuals' lived reality. And it's not a new reality, it's a longitudinal reality.
Thank you so much, Karen. And I'd love to have more of a conversation with you. Not sure if you joined the Inclusivity Caucus or wanted some more information about that, but we would love to have you as a member. Again, our voices are strong, and we can make such a difference. So thank you so much for being here tonight. I'm going to go with Lynette. I'm got 4 hands up. I'm going to get through everybody's hand. I promise you.
Hi, thanks. First of all, I just want from Columbus, Ohio, go Buckeyes. And I'm part of the Inclusivity Caucus. I just want to, first of all, thank you for opening up my worldview when it comes to harm reduction. I'm not as familiar with it as I would like, but as a recovery advocate and a person who's committed to health equity and demanding that spaces include people of color and communities, historically marginalized communities, I never made the connections about the intersection, of people who use drugs, the criminalization of the drug wars with harm reduction, until I saw the slide where it talked about it being a social justice issue, about the rights of people who use drugs. And it just reminds me how we've been conditioned to look at the world through what I believe is a white supremacist lens that says there are different levels of value of people. I'm a person who used to use drugs, so I'm a little bit better than a person who still uses drugs. So I can be at the table advocating, but maybe you're not ready, quote unquote. These are unconscious thoughts that I've had. So I just want to say that was a game changer for me. I'm very grateful. And so I just plan on learning more about this and making those connections and demanding that we all get a seat at the table. Thanks.
Thank you so much, Lynette. And Lynette also forgot to tell you, she heads up our diversity, equity, and inclusion. She is our chair through the Inclusivity Caucus and does amazing work. And I really appreciated being side by side and working with you. So thank you so much. All right, we have Tammy. Again, let's keep it to 2 to 3 minutes if possible. And then we'll call it a night. And thank you so much for being here. You should be able to unmute yourself, Tammy.
Okay. I have a different perspective because I'm white. And with rap, I am trying to be the voice for people of color. And especially like here in Alabama, harm reduction is like slow but non-existent. But we're trying to change, like ban the box and try to get it here in Huntsville. And a lot of my coworkers at one of my jobs, are going through a temp agency and they're people of color. And I listen because I want to be a part of the solution. And I've asked a lot of them, do you know anyone that hasn't been able to get a job because of their past? And they're like, yes. And we want to change the laws. And for me, as a white person, I can tell you there's not lots of white people, like especially with videos, there's not a lot of white people speaking up for people of color. But I'm trying to change that, especially in Alabama. And how do I, like, especially a lot of them are reluctant. A lot of them that truly know me, like the people that I'm talking to, are trying to get people that they know to even write their story, what they faced, the things they faced with the law, even if they don't put their name, so I can help. But how do I get people of color to honestly believe that there is a white person that truly is fighting for them, that it's not a bunch of bullshit, it's not a bunch of lies, that there is someone, a white person in a racist state that truly wants everybody to be love ideas, like everybody, wherever you are, that's what I'm trying to do. And I need, like I tell them, I can't change it unless I have your help. I can't change it unless you speak up. You're the one facing it. I want to be your voice. And that's what I'm trying to do is I want to change this in Alabama. I have felt the stigma and the shame because I love someone that died of drugs. And it's like, I don't like it. And I can't even imagine people that live it on a daily basis. So even people of color that can't get a job, I know what my aunt faced being, arrested for a crack pipe. I understand it and I want to change it. So I want people of color, especially in rap, to help me help people here understand there is a white person that is trying to love everybody, and I want to change it so we can change this in Alabama because it's bad here. And I want people to understand that I am willing to help be a part of the solution.
Thank you so much, Tammy. I always feel your heart every time you share, and really appreciate the work that I know it is not easy. And trust is a hard thing to, again, when we come in even in our personal recovery, I don't care who you come, what background you come from, trust is like the first thing that's very, very hard to break through. Right. And we do see white saviors out there. Some have great intention and some don't. And sometimes some of us don't have time to sift through that. But let's get a call offline, and we'll see what we can do to bringing together an initiative that can help provide some support to you and all the work that you're doing. But don't give up hope. Keep doing what you're doing, hon. Keep doing what you're doing. We're going to end tonight with Nicole. Thank you.
Hey, everybody. My name is Nicole, and I'm from Revere, Massachusetts. First and foremost, thank you so much for hosting this. I have goosebumps, and I feel so inspired, like when we leave here this evening. So thank you very much. But I'm going to be really quick, just a couple of things. So I work for the City of Revere Substance Use Disorder and now Homeless Initiatives Office. We opened in 2016, and during the pandemic, the city had an increase of unsheltered homeless folks that were living in the community. With that being said, when you had shared the slide about housing first, where my office has just recently evolved to, work with the folks that are unsheltered in my community, it really hit home. And I really, like, housing is a human right. And I am, we're working with that right now. I'm a strategic coordinator, and to that end, I did want to just throw out on this piece is that I don't know what agencies folks on here work for, but in terms of housing first in low threshold housing, APA funds will cover that, which is the American Rescue Plan. If you can get it up and running in your locality or your county, they will even, they will pay for refurbishment of city buildings into single room occupancy. So there is a lot of funding that is coming slowly but surely in terms of housing first and harm reduction on a federal level.
Oh, that's amazing. Amazing. Thank you so much, Nicole, for ending us. So again, thank you everyone that was able to stay for those few minutes after the call. We had almost 70 folks on the call tonight and this training. You will have access next week to these slides, to the videos. Also to, if you are looking for more information around the Inclusivity Caucus, you can find a link on WRAP. Garrett, I don't know if you have a minute, if you could throw in our link, the Inclusivity Caucus or WRAP. If you're obviously you've gotten this invitation because you stepped into maybe a new role or you're back on track. And that's why we wanted to call this a kickoff training, right? We're kicking off 2022. We're going to do things differently and we're going to continually to make changes. So keep shouting out, keep sharing the information of what you're doing, keep sharing your stories. Don't give up hope. We all need each other, right? Like I said, there was 70 of us, there was 200 and something of us and mobilized here in Las Vegas. We got some big things coming, folks. So just keep coming, keep coming, keep coming. So thank you so much for tonight.